Palm Island is a tropical paradise in the Great Barrier Reef, known for its sandy beaches, bright blue water and lush landscape. Its Bookelman people have come from all over Australia and share a rich history with over 40 different tribes.
This is a community of around 4,000 people. Some of them are connected to a global body of 500 million people for whom life is a blur. The concerning reality is that the majority of those people have never even had an eye examination. Sometimes a pair of glasses is all that stands between them, clear vision and opportunity.
I sat down with Palm Island Mayor Alf Lacey to talk about the history of the island.
Palm Island itself has a very unique history. Is that the settlement was gazetted first in 1914 as a reserve for Aborigines. The traditional owners accepted people coming and being shipped to Palm, not at their will. One of the elders of the Munbra people gave the name Bulgaman, meaning one, which plays a very significant role in the life of this community.
When it comes to education, 80% of what we learn is visual. So simply, kids who see better learn better.
Bookelman School Principal Jeff Jones has seen firsthand the effect of poor eyesight on a child's learning.
It's one of those things that once again becomes a hurdle, something that can stop us from coming to school. A lot of our kids have poor hearing and a number of them have poor vision. If you have those issues in the first place and you're having to learn standard Australian English, which is not your first language, that's just yet another hurdle. In taking those barriers out, the more that we can do that, the more access we can give to kids to education.
But there's more to it than that. A thorough examination can detect eye diseases and early treatment can prevent blindness. OPSM and OneSight are building sustainable solutions to bring eye care and eyewear to communities in need.
So what brings us here today is to do a basic screening, to do a full eye test, and to then prescribe a pair of glasses to help improve the quality of this person's life. We also give each recipient a pair of sunglasses, which is really protective against the harsh, damaging sun, as well as referring to ophthalmologists if necessary.
I currently work full-time as an optometrist in Townsville at the OPSM store. I heard about the OneSight and the great work that they were doing through our company newsletter, and I really wanted to be involved. So far, I've been fortunate enough to visit 3 or 4 of these communities and provide eye care services to the local people.
I'm assuming that, given the location, we're quite remote, there are no opportunities here for people to have their eyes tested unless OneSight's here.
Absolutely. When we choose a community in which we work and serve, we always make sure that they would otherwise not have the service. So we provide the service where there would otherwise be no access.
You know, there's so much about closing the gap. We're hardly anywhere near closing the gap. When you look at the health statistics for Indigenous Australians, so bringing people like OneSight to the town and engaging properly with the community, then that's what I call closing the gap. That's what I call engaging properly, and we need these small programs that get tangible, good results on the ground and allow people to have access to primary healthcare services like eye health.
We're looking for any diabetic ocular health issues, macular degeneration and cataracts, as well as poor vision, which can be correctable with glasses. We like to take all the local residents, get them into the clinic, do basic vision screening, and then we'll also take them for a more comprehensive consultation along with performing a full eye test.
In a nutshell, what is OneSight's goal, your mission statement, if you like?
Our mission statement is to eradicate the global vision care crisis in our lifetime. It's sometimes just a simple pair of glasses which gives them clear vision. It's about early intervention and prevention of avoidable blindness, and it's about giving people an improved quality of life.
So OneSight is focused on sustainable vision centres. What does this mean?
Sustainable means ongoing care and continuity of care. It's about creating employment opportunities in the community and mentoring and guiding the community to eventually be able to sustain and provide service for themselves.
It's been a couple of days we've been working here now with OneSight. What are the results? What are you seeing?
What we're seeing is between 30 to 70 people coming each day. For us, it's about the number of prescriptions, the number of people that we actually provide low-cost glasses, and that's around 60 of the 70 people. But for us, it's also about that individual.
Recently at our One Sight clinic at Mornington Island, a young boy of 4 years old was brought in by his mother to have an eye test. She had some suspicions that he had trouble with his vision, and they found that he was highly short-sighted. So this poor little boy could barely see 5 centimetres in front of his face. So it really was an amazing experience to be able to put the trial frame on with his correct prescription, and when they did that for him, the first thing he said was, "I can see my mum." So that's a pretty amazing thing, something we take for granted. And this poor little boy was practically blind without this correction and without this help.
We have found that children have taken up the wearing of glasses and have been very proud about it because they actually can see, they actually engage in the learning, and it's something that's quite new for them. That, yeah, once they get the glasses, it all starts to make more sense to them.
The difference One Sight can make to those without access to vision care is profound. To help, visit opsm.com.au/OneSight.